Welcome back to Newsmakers. Our special guest is the Chief Executive of the Canterbury District Health Board, David Mates. Alongside the master plan for hospital facilities, you've been at the forefront of forging a new broad term approach to how healthcare is delivered in Canterbury, and I think it's got this banner of Vision 2020, which does sound a wee bit like a political grouping. I'm sure that wasn't intentional.
It wasn't intended. Yeah.
What's the guts of this initiative?
It really is looking forward, forward to the future. What is it we're trying to do with our health services, and how we're going to meet the future needs of our community? And one of the things, as the District Health Board in Canterbury, we're responsible for about 1.3 billion of health funding. And we're needing to think, how do we best utilise that? And as a District Health Board, we have responsibilities across primary care, the aged care sector, community pharmacies, a lot of non-government organisations, as well as our own provider arm, hospitals. So what we're looking at is how we get all of those parts of the health sector working in the best possible way. The biggest wastage in health services is actually the patient's time. And what we tend to do as a health system, we bounce them from GP to hospital and within the hospital back to the community. And it's really, really frustrating and confusing for a lot of the community. So what we're looking at is how do we stop the bouncing around by getting a health system working as one. So the Vision 2020 has involved consumers, it's involved health practitioners from primary care, aged care, a number of NGO providers in the hospital settings to get a shared vision of how we might in fact be able to do it in a better and more effective way.
And I take it there's been a lot of goodwill from all sides there.
I think most that have been involved in that, it is the first time they've actually been involved in shaping a really common vision of how it could be, of how it could work. And increasingly what we're trying to do with the health workforce is that they become the architects of the future health system. And what we're trying to get better at is describing the direction of travel and getting better at describing the issues and challenges, and then working with the groups to say, so how do we solve it? Yeah. And as we're doing that, we're ending up with some wonderful options and solutions emerging from that.
One example of transformation which I was really interested in is the skin clinic at Burwood. Just tell us about how innovative that has been in terms of its inception.
Well, removal of skin lesions, and a lot of those are cancerous growths on kind of hands, face or other parts of the body. Yeah. And previously, primary care used to refer into the hospital sector. Plastic surgeons had kind of thousands kind of waiting to have skin lesions removed. And the difficulty with that is they were removing the lesions, but a lot of the really complex cases were getting kind of blocked or clogged up with a lot of the lesions. Right. And there's a lot of skills and expertise that sits in primary care, and a group of clinicians got together and said, actually, we've got a better way of doing this. And as a result of that, we've had 65 GPs that have been trained by plastic surgeons to remove the skin lesions. There's another 60 that are waiting to be trained. As a consequence of that, there's a lot of procedures now able to be done in GP clinics, and this year alone we'll end up doing 2,500, 3,000 more skin lesion removals than what we were doing before. And that's a really good example of rethinking how we do it. We can in fact do a whole lot more, and the funny thing with that is it's actually costing us no more than what it was doing before. Gee. And yet there are 3,000 more people accessing services.
Yeah, all right. Integrated healthcare, we hear this term a lot, and I'm just wondering if the youth centre, the 198 Youth Centre, could be argued as being an absolute model of what integrated health is about, where you've got general practice, sexual health services and mental health all under the one roof.
I think if you go back to Youth 198 is a really good example. That was absolutely at the forefront of youth health services when it started, and as a consequence of that has actually shaped the way that youth health services have been provided. There's about 2,500 youth accessing services through that. Through primary care youth health services, there's about 24,000 youth have been accessing services through a range of other primary care models. Yeah. So what we've really got ourselves to is saying, again, we need to step back and look at what is the right way to meet the needs of youth into the future. And a lot of those are actually connecting with social agencies, kind of the Ministry of Social Development, those sort of connections that are not necessarily well connected by just having a total or a simplistic health focus.
Although was 198 dealing with high needs, at-risk young people, more so than the run-of-the-mill young people who would go to their general practice or family health centre?
I think there are, in fact, quite a number of youth services dealing with the same sort of complexity and at-risk youth. Although, again, Youth 198 was certainly meeting the needs of a part of the community.
What I think has troubled a lot of people, including the Chief Executive of the Mental Health Foundation, who has described its looming closure as, quote, deeply concerning, is that there has been all this talk from the Health Board of setting up a one-stop shop for youth health. Now, people are surely going to say, well, you've got one. Why not fund it properly?
There's a number of issues actually with the current model that we would say is actually not a one-stop shop. And there's a whole piece of work that's actually been led by our chairman, Alistair James, on that, is actually stepping right back and working through, so what does and what should contribute or make up a one-stop shop for youth. And there are quite divergent views from youth themselves and from those that are actually involved in the delivery of health services. And what we've got to be very careful is that we don't get noisy groups that end up pushing or shaping a service to a point that may not be in the best interest of youth. We've also got to be really clear is that we don't ever get arrogant enough to say that we know what youth need. And so the process we're going through now is how do we get that starting to define and shape actually what is required. You've
obviously been under a lot of lobbying pressure in recent times. I think Phil Goff was down here last week raking things up. Will the Health Board buckle on 198?
No, the decision for 198 to close actually wasn't a District Health Board decision.
But you're not giving them enough funding, according to Mrs Bagshaw.
And there is, our level of funding to 198 is we'd committed to continuing at the same level of funding as we'd had previously, and there's a wee bit of mental health money that was being shifted. The District Health Board funding was not the sole reason for that.
Okay.
And there are a lot of other issues which, which I won't go into here.
But there is a bigger story to be told?
Yes, there is. And that's not an issue of the District Health Board pulling funding.
When will that story be told? Who will tell that story?
Well, it's, at the end of the day, we had committed a level of funding to there that we're committed to carrying on with. We're advised by Youth 198 that they were no longer able to meet the services, and they'd had some other funding streams from other agencies that were not linked with the District Health Board. And that had changed a set of dynamics there. And again, it's that bit is if we were to go in and rescue every every service, we'd in fact end up cutting a whole lot of others just to prop up services that may not be viable.
Okay, just quickly, are the Bagshaws a thorn in the side of the Health Board?
No, they've been absolutely wonderful, and both have contributed significantly to the health and wellbeing of Canterbury.
Do we need a charity hospital in Christchurch? Is there a legitimate need for that?
Look, a public health system is never going to meet all of the needs of all of the communities, and if there are other ways that services can be provided, we're pretty relaxed and pretty comfortable with that.
Okay, we'll take a break. We are with David Mates, back shortly. Do stay with us.